All-inclusive rates and an experienced care team, you'll feel right at home. Call today to schedule a tour.
Very happy this morning to welcome Dr. Megan Stevens to the show. She is with Erlanger Health Systems, but her background is in stroke neurology.
Yes.
Good to have you this morning.
Thank you for having me.
Maybe if we have time in our conversation, we'll kind of get into some specifics in case anybody watching has recently gone through a stroke. But you're very excited because coming up in September, y'all are bringing a symposium to really kind of reach out to healthcare providers and kind of bring them up to speed on the latest in neuroscience. Is that right?
That's right. So on September 26th, Erlanger is going to be having a neuroscience symposium that's going to give us an update on things like epilepsy, dementia care, depression and stroke, inpatient management of delirium, advances in diagnosis of neuromuscular diseases using EMG nerve conduction studies and ultrasound. There'll even be a brain dissection.
Oh, wow.
So
you're going to do a brain dissection there?
Yeah, there's going to be a brain dissection that's going to be led by the neurosurgery team. And it's not going to be on human brains. It'll be probably like on a sheep, but that, you know, does help us, you know, it would be taking us in a sense back to medical school as a refresher on the anatomy and how that leads to function.
Well, okay, let's talk about that because I know your focus is going to be a little bit on kind of the big ones out there.
Yeah.
Dementia, obviously stroke, epilepsy, I think you mentioned depression in stroke patients, that type of thing. But for many of those who will be in attendance, medical school could have been 15 years in the past.
Right.
You've learned a lot about the brain in those 15 years.
Absolutely. So I think that it helps to kind of like go back to what we were taught, looking at the structure of the brain, and then that helps us to then lead into function. So for example, in stroke, when people have strokes in different areas of the brain, it's going to lead to different symptoms. And so that's a way of tying in, you know, the sort of basic anatomy within the topics that we will eventually go over.
Are you intending this, because it is a symposium, which I guess by the very nature means a lot of lecture, but are you intending it to be a Q&A too?
Absolutely. I think that even if we go back to medical school, I always found it was the most helpful if you were able to ask targeted questions so that you could fill in the gaps of what you were missing in terms of understanding. So after all of our talks, we'll definitely have opportunity for Q&A, and it's always more enjoyable when it's interactive.
Well, because here you're going to have this audience of experts and people practicing in the town. So if they hear something and maybe they want to compare notes, I've found benefit with this. Have you seen this? Are you hoping to accomplish something like that?
Oh, absolutely. I think that it also helps us as neurologists to know where the community is at in terms of what they need help with and what where we can be the most helpful as you know, patients are potentially waiting to get in to see us for consultation. The front line is where patients are going to be seen first. So whether it's EMS, nursing staff, their primary care doctor, whether it's the hospitalist that's admitting and managing these issues initially, we want to be able to make sure that people are well equipped to handle these issues. And then we're very happy to step in and help out as well for the neurology-specific consultations.
You know, the role of a hospitalist is quite challenging.
It is.
And until you've been a patient, it's kind of a new thing in my experience, but they have to really be the one to assess, almost like a triage, where you need to go.
Absolutely. And so I think that that's where we want to make sure that all of the updates that have occurred within care across the spectrum of neurologic diseases, that our providers that are on the front line feel like they are aware of what's possible and where we can help as neurologists.
So I'm sure you're signing people up for this event now.
Yes.
Who do you think kind of should be looking to come? Anybody particular?
Yeah, so whether you're EMS, your nursing staff, whether you're in the therapy service line, if you're a physician, if you're an advanced practice provider, like a nurse practitioner, physician assistant, we have the different tracks that are available within the symposium, and so there should be something there for everybody that's in healthcare.
Real quickly on the dementia part of it, it's so good to use the word dementia and not Alzheimer's, because there's so many different types of dementia. Even from a healthcare perspective, is there more to be watching for as a healthcare provider?
Absolutely. So I think that it's important to know that as a primary care provider or an EMS tech or as a hospitalist, like it's not your job to necessarily diagnose or get into the nitty-gritty of some of this, but
Right.
that's where we will help, absolutely. But yes, that's where like sometimes stroke and dementia, they're not really separate topics. They really have a big overlap because vascular dementia is a really big share of dementia patients.
Right.
And so when it comes to concerns about memory, it's always good to sort of bring those up early,
Right.
so that we have an opportunity when able to work on preventative strategies and interventions when they are available.
And get that imaging diagnostic and that type of thing, so you know what you're working with.
Absolutely.
I will say, as I show you how you can sign up for this, if you are in the healthcare field, if you are a caregiver watching this morning, they've got plans for another event coming in November that will be targeting that population. So
Absolutely, yeah. We're
tuned.
going to have in November a symposium for Parkinson's, which is another really important disease in neurology because it does cross over with not just movement but also dementia. So that'll be November 15th, but our symposium for healthcare providers will be September 26th, and we are going to have our early bird sort of discount end today. So definitely sign up. That will be not just a discount but also parking pass available.
Well, here is where you go, erlanger.org. That will find you, get you where you need to go. 778-9001 is the phone number. Have a packed house and learn a lot. Thank you so much.
Thank you. Thank you for having me.
With McValue at McDonald's, you'll get deals on breakfast, which comes in handy when you've got the whole family in town.
Buy one, add one for $1. Now with Sausage McGriddles and more breakfast favorites. Ba-da-ba-ba-ba.
Linderman's Furniture Labor Day sale means great quality at the lowest prices. Catnapper recliners and power lift chairs up to $200 off. Ashley leather reclining sofas and console love seats up to $300 off. Ashley Benchcraft sofa love seat sets and sectional starting at $8.99. Sit, sleep, and save. Linderman's Furniture will pay your sales tax during Labor Day week. With free local delivery and free disposal of your old furniture, come see why Linderman's Furniture is North Georgia and Chattanooga's best kept secret.